Good day, everyone, and welcome to our CGHI interview series. Today, we're incredibly excited to be here with a very special guest, our president, Charlie. Hello, Charlie. Thank you so much for joining us today.
Hi, Shakin. Hi, Nicole. Thank you for having me.
Mm. For those who may be new to us, the series is our way of introducing and inspiring individuals behind CGHI. And through these conversations, we aim to share their stories, lessons learned, and the motivation that drive them on their global health journey. It's a chance to spotlight the people who make our community what it is: passionate, diverse, and committed to impact. To briefly introduce myself, I'm Shikin, a communication officer at CGHI, joining today from Argentina. Nicole, would you like to introduce yourself?
Of course, and I am Nicole, co-host of the interview series. I'm joining today from the United States. To kick off today's conversation, we are thrilled to welcome Charli Sitong Zhang, Global Development Professional, Mentor, and Strategist. Charli's work spans multiple continents and sectors with over 8 years of experience leading initiatives in program and project management, strategic partnerships, and youth leadership development. Charli's ability to navigate diverse cultures, institutions, and socioeconomic contexts uniquely equips her to lead CGHI's mission of empowering the next generation of global health leaders. We are excited to have Charli today and hear about how she entered this field, what drives her, and her insights in leading a global movement at the intersection of youth leadership and health equity. Charli, welcome. Can you please tell us more about CGHI and its mission?
Thank you, Nicole, for the wonderful introduction. Thank you so much. I would love to tell you more about CGHI to our audience. The Coalition for Global Health Innovation is a global youth-led nonprofit uniting a diverse, multidisciplinary community of over 100 emerging global health leaders across 6 continents. Our mission is to empower our members to transform innovative ideas into impactful action, driving equity and inclusion in global and public health worldwide. At CGHI, we focus on fostering youth leadership by providing opportunities for skill development, mentorship, and access to a global network of partner organizations. We also encourage both interdisciplinary and cross-sector collaboration to strengthen our impact. Through our initiatives such as the CGHI Master Class Series, webinars, online events, biweekly community calls, and our internship and mentorship programs, CGHI fosters an inclusive and productive environment that promotes meaningful dialogue, knowledge sharing, and collaborative knowledge creation. We develop actionable solutions to address existing health disparities across diverse regions and contexts, making a lasting and positive impact on global health challenges. Ultimately, we aim to empower every member of our community to take on leadership roles, challenge the status quo, and advance the global health agenda with a focus on equity, inclusion, and centering community-driven knowledge. Thank you.
Wow, thank you, Charlie, for introducing our CGHI. And let's go back to the beginning. What inspired the founding of CGHI? Could you tell us more about the story behind how it started and how the mission has evolved over time?
Yes, thank you. CGHI, the idea started in 2019. We were attending the World Health Summit in Berlin, and we are a small group of young professionals and students in global health. And the event was mostly very senior professionals. So we decided to start a network of young professionals and students. And then over the years, we became bigger and bigger, and we decided to register as a nonprofit. So we did that in January 2021. So we were founded to bridge the gap between youth leadership and the established norms in global health. We recognize that many young professionals were passionate about addressing health disparities, but often lacked the necessary resources, networks, and platforms to turn their ideas into tangible impact. So our goal was to create a space where emerging leaders from from diverse backgrounds and regions could collaborate, share knowledge, and develop solutions to the urgent challenges we face locally and globally. So over the time, CGHI has evolved to not only focus on building the capacity of young leaders, but also on connecting them with a broader global network of partners, mentors, and experts. This evolution reflects our belief that collective knowledge creation and impactful action with a focus on equity and inclusion are essential for driving meaningful and transformative change in global health nowadays. Thank you.
Charli, you've already explained so much about what makes the organization unique and special, but from your perspective, if you could choose one thing, what would be the most unique aspect of CGHI compared to other global health organizations?
Yes, sure. So our CGHI community is made up over 100 emerging global health leaders from more than 30 countries across 6 continents. So we're truly global. So we all bring diverse perspectives and expertise to the table. We prioritize community-driven knowledge and centering the perspectives and expertise of leaders from regions that are traditionally underrepresented in global health leadership. So this blend of diverse perspectives and multidisciplinary collaboration is what makes CGHI very different from other organizations, hopefully. Thank you.
Thank you, Charli. And as a person who works in CGHI, and I found this is a really beautiful experience. And also, Charli, you have the chance to live and travel in different countries, and you bring such a rich multicultural perspective. How do you think these international experiences have shaped your professional journey in global health and also your perspective on life more broadly?
Thank you, Shakin, for this question because we also met in Egypt when I was living there during pandemic. So yeah, I would love to share my story with our audience. So I was born and raised in China. At 17, I moved to the Netherlands by myself to pursue my studies. I spent 9 years in Europe. I studied and I worked. And that also deeply shaped my worldview because I traveled around Europe and studied all about Europe in my undergrad degree. And then during the pandemic, I moved to Egypt and I lived there for 2 years. And now I'm doing my research in South Africa for the past 2 years. So I lived in Asia, Europe, and Africa. So living and traveling around the world has fundamentally shaped my approach to both life and my work. I've seen first-handedly how cultural, institutional, and socioeconomic contexts affect health systems and health disparities. And all of my experiences have led me to rethink the global knowledge system and the role of international institutions and NGOs. One of the key lessons I've learned is the importance of cultural humility. I see so much wisdom and knowledge in different communities and cultures wherever I've been to. And I think it's very important that we embrace and celebrate all these different knowledge systems and cultures and ways of thinking and expertise from the ground. So in our work, we should let the community teach us rather than go into a community and approach them with a sense of superiority. We must dare to be challenged and open our minds to new ways of thinking and understanding. And I think this mindset has helped me to develop a more empathetic and humble and collaborative approach. And this really reinforced my belief that, all kinds of discussions and solutions should be context specific and truly inclusive. So I hope that, in CGHI, we can really embody that cultural humility and to make sure that all our discussions and our events, our workshops, math class, and in our everyday work dynamics, we are inclusive and we challenge our own status quo and our systems of thinking and thinking patterns. Yeah, thank you.
For sharing your journey.
It's wonderful to hear more about your background and how it's guided by cultural humility. Now, as it relates to CGHI, looking back, is there a specific project or initiative or moment that you're especially proud of?
Yes, Nicole, thank you for this question. So I have to say, my proudest moment is when we organized this webinar on the health crisis in Gaza and Sudan. At that time, I think a lot of international organizations, global organizations, were shying away from what's happening in the world. So in this event, we attracted over 100 attendees, and we had the privilege of inviting 6 very qualified speakers, including representatives from the Sudanese Ministry of Health, the WHO Sudan office, as well as researchers and frontline health workers from Gaza, who shared invaluable insights. And this event was a powerful example of CGHI's ability to shine a light on urgent global health issues and bring together experts from across the world to address them. We focused on the severe health challenges faced by these regions, particularly the impact of ongoing conflict on healthcare systems, access to services, and the broader implications for public health in Sudan and Gaza. And we were collaborating with experts who have lived through those crises, and they are on the ground, and they navigated or are still navigating the challenges in real time. So it was a moment of really collective learning and advocacy. So these are truly, I think, very important and valuable. And I hope more organizations and their leadership and their community and people in those organizations dare to address what's really important and what's going on in this world and not to shy away, because we are not creating political polarization, but we are addressing from the human side, the humanitarian crisis. Thank you. So I'm really, really proud of CGHI and my team and everyone who joined and the speakers for putting this together. Thank you.
Wow, thank you, Charlie. That's really insightful, and especially what you introduced about our project and also the wishes for this field in global health. And this leads to my next question. As a president of a youth-led nonprofit, what personally drives you in this work, and how do you stay motivated through all the challenges?
Thank you, Shakin, for this question. So I have to say it's our community members. It's everyone that I work with, everyone that I get to meet in our community. So we're all volunteers, and we are not paid to do anything in CGHI, and we balance, our other full-time jobs or studies, and everyone with their busy schedules, they dedicate their time and energy to CGHI, to our mission, and they have so much commitment to our vision, and this is very inspiring. And everyone come together with amazing ideas and a deep passion and such a genuine desire to build something meaningful to create a better world. And I have so much faith in us as the next generation leaders of the world. Yeah. Thank you.
So speaking of next generation leaders, for students or young professionals who may be watching this, what piece of advice would you have, especially in the area of building a career in global health and health equity?
That's a very important question. And I think, first of all, we need to believe in ourselves so that we dare to ask questions. We dare to challenge what is been there, what is considered as the expert voice. And at the same time, be humble enough to learn, to challenge what we think we know, and to engage in maybe start with a small group of people where you can talk about your ideas, you can discuss what's happening in the world. And then together you can come up with an idea, with a solution, where you can then invite or talk to more senior professors, professionals, advisors, mentors, so that you can get some feedback from them as well. But at the same time, dare to challenge them. I think that's what I want to tell our community and our audience and whoever that might watch this. And dream big and keep learning, keep traveling, keep talking, keep reflecting, and do things with passion. Find what makes you happy, and find your own path. Yeah, when you find something that's meaningful, it brings you joy, a sense of meaning, a sense of purpose, that's going to be sustainable. Thank you.
Well, thank you so much for sharing that. It's such an important perspective. And that kind of leadership really shape an organization. And what has had the greatest influence on your career, may I ask?
Yes, I would say it's my first mentor, Dr. Fernando Zacharias. We had the privilege to invite him to give our first master class in CGHI. He really influenced me because he made me believe in myself. And at the same time, he made me realize how important it is to build a community and to mentor, to share your knowledge, and to do things out of passion and love, and not just for fame or for the degrees or for like status. So yeah, that's why I became a mentor in the first place as well. And that's why I met all these very inspiring young professionals, my peers, and we started CGHI, and we are continuing to do this. And it's been 5 years or 6 years now. Yeah, so I would say, yeah, DZ is my greatest influence on my career. Thank you.
Thank you, Charli. And then on that note, is there a book or a film that has also influenced you and changed the way that you think about leadership or social change?
Yeah, I love reading. I love watching documentaries. And especially there's one that really stood out for me. It's called The City of Joy. It's from a few years ago. It's about this NGO or initiative, local initiative from DRC Congo. It's from suddenly I forgot his name, the Nobel Prize winner, a doctor from Congo. He started this initiative with an activist. They help women who were sexually violated in the war zone, and bring them together to create a sense of community. And they sing and they dance, they have counseling, and they work together. That really made me realize, first, you need to learn from the local community, and also like find joy in healing and in like counseling, or in like providing access to medicine. It's important to also honor joy. It's not just work, but also like find meaning. Yeah, thank you.
So, Charli, that wraps up our interview, but we just wanted to say thank you for your time. Thank you for being willing to speak with us about your background and your journey with CGHI. It has been truly inspiring, and I think you have reminded us all to find our joy, to remember the importance of cultural humility, dream big and follow our passions, and you truly embody that. So thank you sincerely. And also just hearing more about CGHI and inspiring us about how powerful youth-led movements can be, and how much possibility there is when we come together with a common purpose. We've learned so much from you today, and we're again grateful for your time. It's been a pleasure speaking with you. Thank you.
Thank you so much, Nicole and Shakeen. for your preparation and all these wonderful questions and what you've done in CGHI. And I cannot wait to see you guys interviewing more people within CGHI or connected to CGHI to share our passion with the world. Thank you so much.
Thank you, Charli, for your wishes, and thank you so much for joining us and give us a glimpse into your professional journey and also your personal experiences. It was truly inspiring to see such an insightful and powerful young professional and leader. And I believe your story will really resonate with people who are considering stepping in our global health field. And yeah, personally, I really enjoyed this interview and conversation with you. And yeah, thank you. And looking forward to see where the journey gonna takes you next.
Thank you so much. Thank you to both. Bye for now.
Yeah.